Good afternoon, everybody, and welcome to the Health and Wellbeing Overview and Scrutiny. Apologise for that delay, it was just a technical difficulty, and while I'm on apologies, I'll just apologise for the change of the date from the last meeting. That was partly due to the change of chair and some papers we were waiting for, but there. Our first item on the agenda is to note that the Council on the 3rd of November made changes to the membership of this committee, and myself and Councillor Colin Hardy have been appointed to the committee. So welcome, Colin, to the meeting, and that I have been elected chair. So did we agree that, or was that agreed by Council? Yeah. Okay. So you've got the membership in front of you. So that's the new membership. Apologies for absence. Do we have any apologies?
Councillor Wilczek.
Councillor Wilczek, thank you. Minutes of the previous meeting, they're in your papers. Minutes of the meeting of the Health and Wellbeing Overview and Scrutiny had on the 5th of October have been circulated. Can I confirm there's a true record?
Move acceptance.
Yeah. Yeah. Do I take any questions? Yeah, have any questions from those minutes? No, you're fine. Number 4, disclosure of members' interests. Does anybody have any disclosures for this meeting that are not already declared? No? Right, okay. Number 5 on the agenda is the forward plan. You've had a copy of the forward plan. There isn't any key decisions that affect this committee. Yeah, so any further changes will come back. So number 6 is Health and Wellbeing Board. We have the minutes of the Health and Wellbeing Board held on the 9th of September and the 14th of October. They've been attached. Are there any issues that anybody would like to raise? No? I have one, Liz, could I just ask one? Sorry, I can't see you that far. On page 16, there's the issue of, sorry, just get it out. It's agreed at the Health and Wellbeing Board, you agreed you'd do a deep dive on death statistics and share with the members. Would we be able to have that information? Have you? Yeah.
Yes, we did that, I think, the last, not this one, but the last one. So, yeah, certainly we can share the presentation.
Okay, thank you. Chair, yeah, Councillor Hill.
Sorry, I should have just mentioned this at the previous item about forward plan. Are there any plans to look at the issue of dentistry? Because I think this is a looming crisis about access to dentistry practices and so on.
I think that's on our forward work programme.
Is it on the forward plan? I just skimmed through and I thought I'd just check.
So the forward plan that we've covered is a list of the key decisions that are going to Cabinet. The committee's work programme is at the end of the agenda, yeah, and there is something on there about GPs and dentists.
Okay. Right, so the reports for consideration by scrutiny. Number 7 is the COVID vaccine update, and I think that Jill O'Neill is going to take this, and welcome to our committee, Jill.
Many thanks and good afternoon, everyone. I'm Jill O'Neill and I'm Interim Deputy Director of Public Health. You will have to bear with me. I've been in Northumberland a couple of months now, which has been a delight prior to that of being working over at Durham County Council as Deputy Director over there. So I'm going to give a brief update for you on COVID data, some information around testing, and then touch on Omicron. And then I'm going to pass to Liz for the most recent information based on the guidance and the press releases that came out yesterday, if that's all right. And then Rachel is going to pick up the vaccine coverage. Is that okay for everyone? And I know these slides came out late for everyone. The reason for that, I was just talking to the chair before, is we've tried to give you the most up-to-date information, and because it's such a fast-moving paced picture, that means that obviously we are delayed in providing you with the slides because we want to give that most up-to-date and accurate information. So appreciate on the screens when you're looking from afar, that does look quite a complex graph, but basically this is our England figures broken down by regional areas. So I just want to highlight that currently at an England level, we're looking at 469,000 per 100,000 population have got COVID as a 7-day case rate. The different colour lines are the regions, as I said before, and the ones that are tracking higher at the minute are the southeast, which is orange, and the southwest, which is the red area. It's good to know from a northeast perspective that we are now at the lower end of those regional statistics, and at a northeast level, we've got 388 per 100,000 population. What we will be seeing over the coming days and weeks, even with all of the measures being put in place, that there is likely to be an increase in cases as Omicron starts to potentially take over from the Delta variant. But between Liz and I, will pick up on that in a little bit more detail. So the next slide hopefully you may well be familiar with. This is the dashboard that is produced, and what we can see moving now into a Northumberland level is that our data is showing 378 per 100,000 population. We had been on a decline, but there is a slight uptick now in our cases, so we are obviously tracking that on a daily basis. Our information comes out. What you also have on that dashboard is ward level information, and I just want to caveat that this fluctuates on a daily, weekly basis between when we're getting into the ward level information. But the data that you've got presented in front of you is currently highlighting the Prudhoe and Cramlington patch as higher cases, and Ponteland at the lower end from a ward perspective. And then again, I apologise from a distance, that is really difficult to interpret, but this slide is just showing our Northumberland trend data over time, taking us from back to July 2020 up to November, December, where we are now, and some predicted data for into the January. So you can see towards the far hand right side of the graph, we have been on that decline, but we are anticipating that increase, but we will be looking to look at measures of how we can slow that. And then finally, from a data slide perspective, this is the breakdown of Northumberland's cases by age brackets, and the bottom one tracking along on orange is the over 75s, and it's good to see that our case rates remain really low for that more vulnerable population. The purple line, which is the top one that you can see way above, is for our 0 to 25 population, and if you wanted to drill down into more detail of that, then we are seeing higher cases in our primary school children at the minute, and into our secondary, and that it does also link to our vaccination programme there as well. But the good news is that at the moment in time, the severity of illness and hospital admissions directly related to COVID are remaining low, but it is very much community transmission across our population still. So the next few slides, as I mentioned, are dipping more into our testing programme that we have across Northumberland. We have our community PCR programme, which is for a symptomatic population, and that is what we can see from that is that for the most part 50% of people do choose to come into a testing site to be able to access PCR testing, but there's still 22% of people are choosing to receive postal tests. We do have good coverage across the county for people to be able to access PCR testing. Then moving to asymptomatic testing, where you'll have heard about the LFDs, the lateral flow testing devices, and we do have a national programme for places like care homes that do regular testing and whole care home testing. Our community programme is very much visible within our pharmacies, as well as places like educational schools are able to distribute them. But what we do want to highlight is ongoing challenges around, we are seeking a national testing strategy, because we don't know at this moment in time beyond December what the future holds for testing programmes and the funding that comes with being able to manage and run those testing programmes at a local level. Then moving into our contact tracing, which is our local tracing partnership. That is a nationally coordinated programme through NHS Test and Trace, which is now part of UCSA, which is the UK Health Security Agency. But at a local level, we have NCC customer services teams all trained up that do the local tracing. For anyone who hasn't been contacted by national after 24 hours, we then pick them up at a local level. And in addition to that, over the last few weeks, we've also have gone to what's called Local 4, and that means that after 4 hours of people being able to go through contact tracing if they're COVID positive through a digital journey, we will pick up for our more deprived communities in decile areas 1 and 2, so our most poorer communities. We will also seeking to have local conversations to try and encourage understanding the implications of being COVID positive, and most importantly, making sure people have got everything they need if they are self-isolating as well. And we do average about 50 calls a day coming into our local tracing partnership. So again, similar to the PCR and the LFD testing programme, we do have challenges in relation to looking at what the future holds for testing. We've got a great team at the minute that is redeployed to do this specific work, and we need to understand what the future holds to see how long we need to maintain those temporary contracts. There's also been a recent development of having more data specified around how we're doing in relation to making contact with our local population and understanding the quality and performance of that as well. So there's a huge amount of work undertaken around testing as a key pillar and plank of our prevention programme. And then the next couple of slides, I suppose, are just to highlight where we're at with Omicron. And obviously, I'm sure you've all seen on the news that all viruses mutate over time, and that is very regularly taking place. But a variant becomes classified as of concern when there is evidence emerging to show that that change could potentially be causing more harm. So things that we tend to look for from a scientific community perspective for it to be classified as a variant of concern are increased transmissibility, more severity of illness, vaccine escape, that kind of thing. And again, you'll have seen emerging on the news is that we remain very cautious in relation to Omicron, and it does appear to be more transmissible than the Delta variant has been, but it is showing that with the fully vaccinated and the booster, then it is very much looking promising for vaccines to be able to prevent severity of illness. But what we have seen, because of that speed of transmissibility, the potential volume of cases coming through is something that we need to be able to slow the transmission down, which is where Liz will come in around the most recent guidance that we've got coming out. So the new measures that have come in place to try and slow that spread of Omicron are around, obviously, that quickening up of the booster programme, which we'll pick up on later. The mandating of face coverings, which was just in the shops and communal areas, but is going to now be in most indoor spaces and where there are crowds. And then the travel changes as well, both for people wanting to leave, and there's more countries on red lists now, and also anyone coming into the UK is now being asked to take tests prior to entry to the country and then 2 days afterwards as well. So there's some of the changes that were at the point of writing this yesterday afternoon, and now there are obviously more guidance following the announcements of part of Plan B coming in. And again, from the changing dynamic of the cases, nationally, when we wrote this, there was over 400. Now there's over 500 confirmed cases across England, but that's likely to be more because of not everyone necessarily being sequenced to know that they've got that specific variant. We are working incredibly closely, and it's a national directive, but very much happening at a local level, that our health protection teams are leading the work around all confirmed and probable Omicron cases to be able to do very rapid and tightly controlled contact tracing. At this moment in time, any contact of a confirmed or probable case of Omicron is being asked to isolate for 10 days, irrelevant of age or vaccination status. You may have seen on the news that that could potentially change to daily testing instead of self-isolation. But again, we are very much awaiting the guidance to follow the public announcements that have come into place. And we've also got in place rapid PCR testing for any contacts to go and be couriered to Porton Down labs to be sequenced to see whether or not they are also Omicron cases. So it's a real national coordination, and then very much locally tight coordinating through Liz as our Director of Public Health and with our local health protection teams. So just the last couple of slides before I hand over to Liz is the what next really. We maintain a local health protection board, which is our tight governance that we have, and are continually reflecting and updating our local outbreak management plan. We are tracking carefully our case rates. We are obviously looking at Omicron, but remain vigilant for any other variants of concern that could come up on the horizon globally. Funding, as I've alluded to, we need to understand if we are going to continue with our stringent efforts around COVID, then funding hopefully needs to follow with that, so we can continue with testing and such like, if that's going to remain a core plank for our prevention programme. Part of that is testing, and underpinning all of this is the workforce to be able to do this. So not only within our health protection team, but the additional workforce within our local authority public health teams as well, and all of the workforce indeed for vaccination and such like, to be able to do the mobilisation at pace that we are required to do. So the final slide for me are the key messages that, we make no apology, are very similar and have been the same messages throughout all of this, which is about the caution of hands, face, space and fresh air. It's the continuation of the ventilation in enclosed spaces, the get tested if symptomatic, the regular testing of asymptomatic twice a week, and that real push for full vaccination coverage, not just for boosters, but for those who haven't come forward for vaccination, which is all the Inequalities work that's being led on locally. Being considerate of others around the face coverings, and just being kind to each other, because there's still a lot of anxiety around COVID and the implications. So I'll pause if that's all right, Chair, and I'll hand over to Liz.
Do you want to take questions now? Or?
It might make sense if we do a bit of a double act, because Liz might cover some of the questions, if that's okay.
Thank you. I thought it might be useful to just give some background to why those changes were made yesterday. I think what we're becoming increasingly confident about is that the Omicron variant is out-competing the Delta variant, which, as you'll be aware, is the one that we were dealing with about this time last year. There's a couple of reasons why it's out-competing the Delta variant. We think part of that is around its ability to evade part of the immune system, and the other bit of it is about increase in transmissibility. So when I looked at the figures this morning, we had 568 cases, confirmed cases of Omicron across the UK, but of course those 568 cases are just the tip of the iceberg, and it's likely that actually there are thousands of people with this Omicron variant. And if that figure is doubling every 2 to 3 days, then you'll appreciate that it doesn't take very long before we start to see very large figures. If that is the reality, then pressure on the NHS could be unsustainable very quickly. So the booster is really important. It's important because actually the early evidence from Pfizer, and we are talking about relatively small numbers, but there are early indications that the booster gives much higher protection against severe disease and transmission. So the introduction of these further prevention measures are needed to slow down transmission so that we can boost as many people in the country as we can, to provide as many people as possible with that boosted immunity, which will protect the vast majority from severe infection. So the additional prevention measures that were introduced yesterday are around face coverings. So face coverings will become mandated in the majority of indoor venues from Friday. So that includes places of worship, but not where it's impractical. So if you're going to the gym, or if you're going to participate in a choir, or you're singing, then you don't need to wear a face covering. From Monday, people are being asked to work from home if they can. And from Wednesday the 15th, subject to parliamentary approval, the government will be introducing an NHS COVID pass process. So for the COVID pass, you either need to have 2 doses of the vaccine or you need to have a negative lateral flow test. And that will be required to access nightclubs, any indoor unseated venues with more than 500 people, any unseated outdoor venues of more than 4,000 people, or any venue over 10,000. And I don't think we have too many of those in Northumberland. I think what we're dealing with at the moment also is a bit of a pandemic within a pandemic, because we're trying to manage Delta cases and Omicron cases, and we're managing those a little bit differently, which can be quite confusing. But obviously the priority is to keep the workforce going in a safe way, because what we don't want to end up in is a position where we had lots of critical staff off because they were self-isolating. So as part of that process, for the management of Omicron close contacts, we're introducing a process of daily contact testing to enable people who would have been okay not to self-isolate to continue to go to work, even though they're an Omicron case. I think the UXA is quite conscious that the management of these cases needs to be aligned because of the confusion, and I think they're sort of working through the process of how we do that at the moment. Still, I think a lot of uncertainty about the virus, and in terms of severity of disease, I don't think there's a huge amount of evidence at the moment that it causes more severe disease. But we just need to wait for the science, really, for a lot of these areas of uncertainty.
Thank you, Liz. Questions? Councillor Dodd.
We've been at this a while, and I go back a little while when I was certain jobs, and it's, have we made any impression on the 10% that refuse to have a jab? I read in the paper all the time that beds are taken up by anti-vax people. You know, I understand it's moving, everything's a moving feast. We don't know what's going to happen for Christmas and all that. But is the 10% the problem? And I think it's about 10%.
Councillor Dodd, I think this question really comes in the next section, which is the COVID vaccination programme. Are you all right if Rachel takes it later?
Sorry, yep, I'm happy with that later.
Yeah, we're just saying, perhaps if Rachel, do you do your presentation now? Because clearly there's going to be a crossover, so you could all ask the questions later. Is that okay with everybody? Yeah? Thank you, Rachel Richardson, if you want to do the COVID vaccination. Okay.
Lovely. So myself and Richard Hay are going to do the presentation. So Richard's going to start, and we'll try and answer Councillor Dodds' question within the presentation. Thanks, Richard.
Thanks, folks. Yeah, just to give you an update today on the progress we've made with the vaccination programme since we last attended the committee, and then Rachel's going to sum up at the end and talk about some of the next steps in the programme and where we go from here. So yesterday was the 1-year anniversary of the start of the COVID vaccination programme in England. It was the 8th of December when the first COVID vaccine was delivered in England to Margaret Keenan, and it was a week later in Northumberland when we delivered a vaccine to a lady called Jean Jones in Ashington. So fast forward to yesterday, a year on, and we've delivered almost 100 million COVID vaccination doses in England, and within Northumberland we've delivered 635,139 COVID vaccination doses, made up of first doses, second doses and boosters. Just in an attempt to kind of break those figures down and give a sense of the scale of the achievement that this programme's been, over the 365 days, that works out at an average of 1,740 jabs per day, every day, at a rate of 72 vaccinations being delivered per hour, every hour. So that all boils down to a jab being delivered every 49.6 seconds for the last year, which is pretty mind-blowing when you consider it. And that's additional work that our local health and care system's taken on that they didn't have to do before that. So a really phenomenal achievement. The next slide, similar to the graphs Jill showed in her presentation, this isn't intended to be studied sort of in detail. It's just to give you an idea of the kind of mountains, as Rachel and I occasionally describe it, that we've had to climb during this vaccination programme. And quite often it feels like just as we summit one mountain, another one comes into view in the distance, and we have to scale that one as well. So they're the three main phases of the vaccination programme. You can see there the first doses, the second doses in the middle, and then more recently the rollout of the booster programme, which is set to encounter another mountain, which Rachel will talk about, which is the expansion and acceleration of that programme. So in terms of vaccination opportunities we've got across the county, I've talked about these before, but I just want to reinforce the range of opportunities that we've got for residents to be vaccinated. We've got a network of 11 primary care-led vaccination sites across the county that are led by groups of GP practices working closely together. We've got 11 community pharmacies across the county delivering vaccinations accessible via the National Booking Service. We've got one hospital hub that's in operation at Wansbeck General Hospital, which has been there to vaccinate health and social care staff. We've talked before about our roving vaccination unit that's been in action far and wide across Northumberland, and also providing assistance to places elsewhere in the North East region where they've struggled with uptake. So that's been a really big plus in terms of the vaccination programme, has been commissioning that model. More recently, we've also had the school-age immunisation teams come on board and start helping out with the vaccination programme as we started delivering vaccinations to the healthy 12 to 15 cohort in schools. We've had community nursing colleagues delivering and continuing to deliver booster doses to housebound patients. And we've also had a number of hyper-local pop-up clinics and initiatives that we've put in place to try and boost uptake as much as we can and try and address some of that 10% that Councillor Dodds was talking about there. So examples of some of those initiatives are things like walk-in clinics and grab-a-jab opportunities that are advertised nationally. We've done a lot of work with maternity services locally to focus specifically on pregnant women and increasing the uptake of vaccination amongst that cohort, because there's quite a lot of evidence that they can be adversely affected, particularly by the Delta variant. So we've done a lot of work providing maternity-led clinics or maternity-facilitated clinics where pregnant women can come in and discuss their concerns about the vaccine with their midwife or with a health visitor, and hopefully put them at ease and address some of their concerns about the vaccination. So we continue to offer a really comprehensive range of services for people to access the vaccination programme, either by the National Booking Service or by local booking at quite a lot of the GP sites. So in terms of where our uptake ranks against the rest of the country, we currently have, and we're very proud to have, the highest percentage uptake of first and second doses for any upper tier local authority area in England. And that's a position we've held for quite a while now, which is excellent, and people still continue to come forward to receive those first and second doses. The booster programme, which has been live since the end of September, we're in the top 10 for percentage uptake so far for third doses and booster doses as well, which is a fantastic achievement, and that's set to rise even further with the impending acceleration of the programme. So I think if we'd all sat here a year ago when we first started vaccinating and we'd said, you know, in a year's time, 9 in 10 of the over 12 population of the county will have had a first dose of vaccination, and over 8 in 10 will have had a second dose, I think we'd have all, you know, snapped people's hands off. That's a fantastic position to be in. We've got some of the best protected residents in the country, but as Liz and Jill have talked about, there is more to do and another mountain to climb in terms of accelerating the booster programme. Just to focus a little bit more on the uptake within age bands and what it is that sets us apart from the rest of the country. If you see from the chart there, it's really evident that actually it's our working age adults and younger people that have set us apart from the rest of the country, and the numbers that they've come forward in to receive their vaccine is where we really stand sort of apart from the rest of the pack. So our under 50 population are 10.4% better protected or more vaccinated than the national average, compared to just 5% for those over 50. So I think testament to the young people and working age people in Northumberland, and testament to the community spirit that we have across the county, that people have been willing to come forward and get themselves vaccinated, not only to protect themselves but to protect those most vulnerable residents in our communities as well. Focusing particularly on care homes and home care staff and some of our most vulnerable residents, we've seen fantastic uptake of first and second doses across all of our care settings and our independent domiciliary care staff. I wanted to draw your attention to some of those slightly lower numbers as well, and just put those into context. We've performed initial visits already to all of our older adult care homes to deliver boosters, and there are mop-up sessions ongoing to pick up those residents who, for whatever reason, may not have been able to be boosted the first time round. Potentially they'd recently had COVID and were recovering from a positive test, or they had an outbreak within the home. So we're trying to mop up that remaining kind of 17% of care home residents for a booster. In terms of staff, there is an ongoing offer available to staff to get them vaccinated with their booster. And although some of those numbers look quite low, that's actually in the top 10 upper tier local authorities in England for a booster rate for care home staff. We'd love it to be a lot higher, and we're continuing to push opportunities for vaccination to care home staff via lots of different routes, be it the hospital hub or accessing some of the national booking service sites. We've also made really good progress on our younger adult care homes. They are tracking slightly behind their older adult care homes just because of JCVI prioritisation. The younger adult homes are in cohort 6, so being picked up at the moment, as I speak, in terms of visits from primary care teams going out and vaccinating the residents of those homes. Equally for staff in younger adult care homes, we're well towards the top of the national picture there in terms of uptake. Again, similar to the older adult care homes, we'll do as much as we can to promote uptake among staff. And actually there is mandatory vaccination for care home staff and people who attend care homes for first and second doses, which explains why those figures are quite so high. Moving on finally to domiciliary care staff on this slide. That's actually the 4th highest figure in the country, so fantastic coverage of what is a very disparate domiciliary care workforce across Northumberland with a really complex network of providers. So a fantastic bit of work being done there by the social care team in the county to corral all of those people and make sure they all know where to access the vaccination and how, and brilliant cooperation from providers to make sure the service has been able to be offered to them. The only other thing I'll add on that data is that this is the most out-of-date data that we've got in the presentation. It's updated every Thursday at 2 o'clock. So unfortunately, had the meeting been 20 minutes later, I could have given you the most up-to-date picture. But this is kind of last week's data, so those figures will absolutely have gone up. Just to cover what we've done vaccinating children and young people, this was a mountain that loomed into view towards the beginning of September as the schools went back after the summer holidays. And we were tasked with delivering a programme of first dose vaccinations to healthy 12 to 15-year-olds. It was intended that offer would be made in schools in the first instance and would run alongside the 16 and 17-year-old vaccination programme that was being delivered in primary care. The first dose uptake we've had for 12 to 15-year-olds has been really fantastic. The work of the school age immunisation service has been great. We had a bit of a slow start with that cohort, but then gathered momentum towards October and into November. And we're now within the top 10 local authorities nationally for uptake of the 12 to 15 cohort, which we're very pleased about. The most recent guidance that we got at the end of November and at the start of last week is that JCVI, the Joint Committee on Vaccination and Immunisation, are now recommending a second dose for 16 and 17-year-olds and 12 to 15-year-olds. So we're in the process of planning what that rollout looks like in the new year to deliver going back into the schools, but also a hybrid approach with an out-of-school offer via the National Booking Service at community pharmacy sites and primary care sites for 12 to 15-year-olds. We also anticipate the uptake to grow for first doses quite significantly over the next few weeks. That's following a change in the guidance around how long after a positive COVID test a young person should be vaccinated. Originally, that post-infection interval was around 28 days. That's now gone out to 12 weeks based on emerging evidence and data in terms of how much of an immune boost that vaccination gives you. So there are quite a lot of young people who had COVID either during the summer holidays or just as they went back to school who will be within that 12-week window and will become eligible as we move into the new year. So we'll make sure whatever offer we take back into schools also picks up those extra first doses as well as second doses for people that have already been vaccinated. And then just the final point at the bottom there, nothing's been confirmed on this yet, so nothing concrete, but we do anticipate and are making plans for the eventuality that we get regulatory approval of the vaccination product themselves, but also scientific advice on the vaccination of 5 to 11-year-olds. So that's another mountain that may well loom into view in the new year. Just to summarise quickly where we're at up to date, as of now with boosters, and then Rachel will talk about what's coming next. The booster programme commenced in late September with a view to deliver boosters to people in JCVI cohorts 1 to 9, so that's everybody over 50, and all of those either clinically extremely vulnerable or at risk. The preferred vaccine for the booster programme are mRNA vaccines, some messenger RNA vaccines, namely Pfizer and Moderna. And the original window for delivery of those boosters was no sooner than 6 months after the second dose of that patient's primary course. We were able to co-administer the first phase of boosters with flu jabs, so we were able to get really strong uptake of both our flu and COVID boosters this season, which was a real help to us operationally, and in terms of getting those patients in efficiently and being able to jab them twice. Phase 3 also delivered third primary doses to severely immunosuppressed individuals. This is something that caused a little bit of confusion at the time, but I think we've tried our best to explain the difference between a third dose at 8 weeks after the second dose and a booster dose, which comes 6 months after. So an update on figures with the boosters. We've done 128,257 boosters as of 4 p.m. yesterday. The national figures quote that as 43% of the population. Confusingly, though, that's the 12-plus population, and quite a lot of that population aren't actually eligible for a booster. So when you break it down into those that are currently within scope of the booster programme, those 40 and over, we've done 60% of the boosters, and actually it's 78% of those when you look at eligibility for the previous window of 6 months. So we've made really strong progress with the initial phase of the booster programme, and are ready to stand up additional capacity to take us to that next stage. Moving on to address Councillor Dodd's concern around the 10%. The 10% has decreased quite a bit. I think when we previously talked about 10% that were unvaccinated, that was the adult population. We've now got 10% of our 12-plus population, but we've seen quite a lot of adults continue to come forward for vaccination, to the extent that we've now only got 4.1% of our over 50 population, so those most vulnerable who haven't received a first dose of vaccination, and then 15% of our 18 to 49 population who haven't received a first dose. But we absolutely maintain an evergreen offer of vaccination, and that's something that is promoted almost equally as importantly as boosters. The booster is a great boost, the clue's in the title, to people's immune system, but equally important is getting those people who haven't had any doses yet vaccinated. So we do continue through the work of the Northumberland Vaccine Equity Board, and through all of the comms and engagement work, we do push that evergreen offer, and we do see people continue to come forward as things change nationally, new variants and new restrictions. People's minds are changing, and that's absolutely fine. We'll be ready and willing to vaccinate anybody with the first or second dose when they come forward. And if anyone wants a one-to-one conversation or has any concerns, we're more than willing to address those, through one-to-one conversations with clinicians to make sure we're promoting it as much as we can. So hopefully that gives you a little bit more reassurance on where we're at with the unvaccinated population. In terms of the booster challenge to come, we've got another 145,585 boosters to deliver now in a very condensed timescale. And Rachel's going to now take us through the next steps in the programme, and where we go from here after the next phase.
Thanks, Richard. So where are we now? I think Richard's given a flavour of actually just how complex this programme has now become, with all the different priority cohorts, the dosing intervals, and all the points of delivery to contend with. And we now have the single biggest expansion in response to the Omicron variant. So JCVI have recommended that we boost all adults aged over 18, and the target set for that completion is by the 31st of January, and that is that 150,000 people, which is a huge ask. Booster doses for the severely immunosuppressed patients is also now recommended at 8 weeks after the third primary dose. And as of the 8th of December, boosters are now available and being offered no sooner than 3 months after the second dose for the people in cohorts 1 to 10. So boosters will be offered in cohorts 11 and 12, which covers your sort of 30 to 39s and your 18 to 29-year-olds, once the invitations have been announced nationally. And we are looking at some sort of additional capacity is made available to help us with the delivery of that, which I think we potentially are going to need. So the challenges and the next steps. This is a very nationally controlled programme, which can be quite challenging at times because it leaves our teams with all the responsibility but very little of the control. We still are juggling sometimes on a daily basis the sort of course corrections and changes in guidance, which give us quite a short notice period in order to make those changes. And you know, often we do joke that we hear about it on the media first before we actually hear the guidance officially. The supply of vaccine can be unpredictable at times, which makes it really difficult to do that long-term planning, both in the point of view of recruiting workforce in order to meet the demand, as well as setting up the clinics and being sure that you're going to have the vaccine in place for those clinics to run smoothly. Equally, we have a very tired workforce out there. Primary care have done a phenomenal job. The GPs, the nurses, the volunteers, everybody working are feeling very tired now. And we absolutely need to maintain their efforts as we have this mountain to climb by the end of January. Effective communication engagement and public confidence is absolutely crucial in order that people come forward, and we are regularly putting comms out with regard to that. The planning and further expansion and extension of the vaccination programme now in order to be fully prepared as possible is where we are going. But again, it is back to this is very much controlled nationally, so we have to just follow what we get told to do when we need to do it. But we are told that obviously the government has supplied the boosters till the end of 2023. So it is really important that we get on to some more longer term planning, because this isn't going away, and this is something we're going to be doing for quite some time. Just a really big thank you at the end, really, because actually this has been a truly integrated approach across Northumberland, and it has been absolutely phenomenal. And there's a list of all the people that have been involved. So yeah, just a really big thank you. We just couldn't have done it without the great support across all our stakeholders to deliver what has been a really excellent programme throughout. And then just finally, there is our very first lady that was vaccinated on the 15th of December, getting her first getting her first vaccine, and just those stats that Richard went through, which I think just shows how much work's been done. You know, 1,740 jabs every day for the last year is phenomenal, and that's all we have to say. Thank you very much.
Thank you, and thank you all of you for that presentation, a very full one. I'm going to go back to questions. Councillor Dodd, was your question answered? I know I cut you off before. Yeah.
Just say thank you for that update, because I know we stuck at a certain crowd and it looks like you're making inroads. So I don't know, I mean, there's one country that said they're going to compulsory vaccinate everybody, so I don't know, we're not there yet, but it might have to be something like that if we can't get on top of whatever's coming this next winter. So I'm just interested in the numbers, and you're making inroads, and that's welcome. Thank you.
Thank you. Councillor Hill.
Thank you. I've got 3 points stroke questions. I know I'm going to sound quite cynical here, but I think that's a healthy position to be in a scrutiny committee. The first is, when COVID first hit, there was quite a surprise at how the public complied to lockdowns and so on. And there's actually quite a small dissenting voice to what was happening. And as time's gone on, that dissenting voice and cynicism has grown. And I think it's very apparent that with the latest measures, the almost exclusively people I'd heard were cynical about this. I mean, obviously you've got the Downing Street party, or the cheese and wine, and you've got the fact the fatigue of lockdowns, and obviously the rationality about the new measures. You know, things like you can sing in a nightclub and dance around without a mask, but not in church, and so on. There's many aspects of it that don't seem very rational at all. So my first question is, what can we do about the growing lack of the public being willing to accept these measures? The second point is, it's interesting, and you're talking about looking at the science. I mean, there is a school of thought that the new variant is following a a typical path where it becomes more easy to infect people, but it's actually less virulent. But obviously, as you say, the science needs to confirm that. Again, talking about a discipline of scrutiny, one of which is being cynical, when they say things like evidence from Pfizer says the booster helps, you know, the obvious problem with that is that Pfizer are selling these things. So the people that's selling and profiting from this shouldn't be the people you're looking for the evidence. I think that's just a simple point. I'm not saying they're incorrect. They might be perfectly correct. But is, in terms of regulation, is there not a more independent body that can verify that rather than people? Because we see this, you know, we talked about the first jab and then the second one and a booster, and there might be a fourth. I mean, soon as are we going to get a daily one? You know, how far are we going to go? So we need to be confident of the evidence, and if it's the people that benefit, you have to be a bit cynical about that and have more independent verification. And the final point is talking about the NHS can't cope, and can't cope even if it's a case, which it does seem to be this new variant. There doesn't seem to be a lot of people dying, but obviously taking up hospital beds and so on. So would the NHS be able to cope in a normal winter if COVID didn't exist? And isn't a wider thing, and something that we should be seriously concerned about, is that the NHS can't cope full stop?
Thank you. Valid questions. Who's going to answer these?
Okay, so your first question was about compliance with prevention messages. And I think the first thing that I would say is that we need to be very clear about the science and be very clear about the uncertainties of the scientific evidence as it is at the moment. I think there's been quite a bit of talk about, you know, behavioural fatigue, but I understand that in psychology terms that doesn't exist. Actually, people will adopt those behaviours that keep them safe. And I think giving clear messages about the scientific rationale for the prevention measures that have been put in place is going to be really important. In terms of the evidence around the Pfizer vaccine, I mean, that is open access data. So, you know, that has been peer reviewed by academics across the scientific community. But I think it still needs to be seen with a little bit of caution, because it was, you know, no doubt it was relatively small numbers. And of course you need lots of numbers, lots of people to be included in those studies to give us confidence that that is the case. But, you know, the MHRA is the regulatory authority, so they are the arbiters of the evidence around vaccinations. And then your third point, I was going to pass on to my NHS colleagues.
So this is about winter and how the NHS is coping with the increase in beds. So I think COVID provides an extra challenge. So when you hear from Northumbria that they've had for a while about 50 COVID patients in their hospital, which doesn't sound like an enormous number, but I suppose it's 50 additional people that they wouldn't have had we not had COVID. And I think the challenge for them is the infection prevention control and how they manage those patients, how they can move staff around is restricted, and that then is what makes the logistics of running the hospital quite a challenge. Equally, some of those patients that become very poorly then end up going on to critical care or respiratory care, which I guess also make their recovery longer, and then they require additional help and support to be discharged and rehabilitated and get back home. So I suppose it just does place an extra pressure in the system that we wouldn't have had in a normal winter. So yes, we do have an increase in respiratory, but these patients, I think, cause an added pressure just because of the infection prevention control and the other things that I've mentioned. I'm not sure if that answers your question, Councillor.
It answered as far as I was going to get an answer to. But
Thank you. Councillor Hunter?
Thank you, Chair. Just one or two questions as to accessing the lateral flow kits, because now it's not so easy to just get them, go into the pharmacy and get them. It's to go online, get a QR code or a code. And not everybody can actually do that. Not everybody is IT literate, and I think it's, you know, if we're going to, especially if they're talking about going on to probably daily testing, it's trying to get these kits and how we can work that. And the booster rollout is to, you know, first of all, thank you to the staff that have worked in the last year. They've worked really hard to get to where we are. And as you say, every time you get to what you think is the top of the mountain, the next mountain arrives. I know up in the Berwick area, we're still in the 60 plus brackets. They're just getting called forward now. So I think it's how you can manage to get it within the time scale that the government wants you to get it to. It's how you're going to manage that. And again, it's the hard to reach ones. I know you're down to about 4% on some areas and that, but you know, you're sometimes hearing people saying, well, I've had COVID, so I don't now need to bother getting it, because they think, because they've had it, they won't get infected. And I think it's how we get that message out to say it is still valuable, because even if they don't get seriously ill, they could make somebody else seriously ill.
Thank you. Who's Liz? Okay.
So I think you make a really valid point that actually, I mean, clearly it's not a local authority policy, but the national policy to require people to get a code before they can collect their lateral flow tests is in effect putting a barrier in the way. But we do have our sort of roving vans that are going around the going around the county even, dropping LFTs off at both at community pharmacies, but also at a number of sort of community venues, so post offices, shops, that sort of thing. So, part of our testing or LFT testing strategy is to make sure that we target those communities that might find accessing testing quite tricky. I will just check that a QR code isn't required for those, and I'll get back to you on those.
Just on your point about vaccination and capacity and how we meet that challenge, one of the things we've done and are continuing to do at the minute is review the capacity that we've got to deliver this accelerated booster programme right across the county. And one of those things involves going back out to community pharmacies for more expressions of interest to see if we've got more pharmacies interested in joining the programme. And one area in particular we've asked them to focus on is that area around Berwick and Sea Houses in particular, where we know that access isn't quite as readily available as it has been elsewhere in the county. So we're hopeful we'll be able to do something fairly positive about access up there in the near future.
You happy? Yeah. Councillor Nisbet.
My question's on the ethnic community. We recently, well, all the Blythe Valley people have had councillors have had a letter from the doctor's practice, and it was about supporting them to try and get more of the ethnic community to come forward and get the vaccinations. Now, how we can do that, I haven't got a clue, but if there's any insight, any knowledge from yourselves would be appreciated.
So vaccination of Black, Asian and minority ethnic communities is one of the key objectives we've got of the Vaccine Equity Board that we've got in Northumberland. There's a huge amount of work gone on, particularly in the Blythe Valley locality, to engage with minority ethnic communities in that area, and some of the council and the communities together teams have done some fantastic work engaging with faith leaders. I guess, that ask from the GP practice is just, I think, around general community spirit and trying to encourage vaccination and good practice and good behaviour as much as we can. We'd be equally keen to hear any ideas people have got about how we can increase uptake amongst those communities. A lot of the time it's about trusted voices within those communities and getting them engaged, and that's something we're continuing to do through the Vaccine Equity Board. We've got pretty good data on ethnicity and where we've got challenges. We know, as you say, Kath, that Blythe is a particular area of challenge, but equally in the north of Northumberland, we know there's an Eastern European community there that needs more work to be done on engagement and pushing vaccinations there. So that's another area we're focusing on and have done some work on getting some additional resources available for those communities in the languages that they speak to encourage them to come forward and receive vaccines. So yeah, absolutely. Pushing vaccination in those communities is something we're going to continue to do into the new year through the work of the Vaccine Equity Board, and we'll link in with elected members where we can.
Councillor Bowman.
Thank you very much for that. Can I just follow on? I came across somebody who had COVID-19 and this person never been vaccinated. But strangely enough, when this person recovered, it was the first thing they did. So would it be a wise thing to contact people who were of the mind not to be vaccinated for whatever reason, and let them get the message out there into the community? It is wise to be vaccinated. You're not just protecting yourself, but you're protecting your community as well. Thank you.
Thank you. Anybody else? Councillor Ferguson.
Thanks, Chair. It was just a question about the booster rollout. So I was speaking to some residents in Alnwick quite recently who were in their 70s but struggling with actually, when they were trying to book online for the vaccine boosters, they were finding that the nearest appointment they could get was in Morpeth or further away, rather than being in Alnwick. I know in the presentations that it showed like the various areas where we had clinics, and there was obviously one in Alnwick, but for whatever reason they weren't being given that option, and so they'd been waiting weeks for a booster and hadn't booked in because they weren't able to travel to Morpeth, and they weren't able to get in their local clinic. So I was just wondering what was sort of being done to make sure that people who are, whether that was a problem with the booking system or whether it was availability. Cause I know there's been obviously supply issues over like in the past months with things, or whether it was, I mean, what's being done to kind of make sure that the people who are eligible are being able to access the booster doses.
Yep, thank you. That's a really good point, and I think the key thing to point out here is the difference between the two routes to access the vaccine. So we have national booking service sites, community pharmacies in particular, and one or two of our primary care-led sites. But the majority of our GP sites actually operate local booking, and they do their call and recall locally and invite patients in priority order, and don't often or aren't able to open up their cohorts quite as quickly as the national booking service does, purely because the way the supply of vaccine works. So for those patients in Alnwick in particular, the site that we do have in Alnwick is one that operates local booking. And I know they're working through their patients absolutely as fast as the supply they've got will allow them. In terms of the national booking service, yeah, that only unfortunately shows you sites that are signed up to deliver national booking service. So it does look like from that kind of route that we do have a few gaps. But our data kind of tells us that we've got really good coverage across Northumberland with that blend of local booking and national booking, and we'd encourage those patients to be patient. I think we're seeing a return to that messaging now with the booster programme, to be patient and wait your turn to be called in, and absolutely confident that the site in Alnwick will be calling those patients in when they've got vaccine and when it's those patients' turn.
No, that's really helpful, thank you.
Thank you. Sorry. Any more questions? No? Right. Well, can I thank the whole team for all the information you've given in your presentations and your answers to the questions, and thank you, councillors, for the questions. If we move on to item 8, which is the Director of Public Health's annual report for 2020.
Thank you very much. So, as you'll probably be aware, one of the statutory responsibilities of Directors of Public Health is to draft an annual report on any aspect of population health that we think is important for our particular population. And the local authority has got a duty to publish it. I think the DPH annual report is really useful because it provides us with a bit of a springboard to inform local people and partners and stakeholders about a particular aspect of health in our community. And it also provides commissioners with some important information that they might want to take into account when they're commissioning services. Now, inevitably, this year's report is about COVID-19 and the pandemic. It was written several months ago now, during sort of June and July, when we saw that very large wave of Delta cases. So it very much reflects the situation up until that point. So it's a bit of a combination of 2020 and 2021. So I think what we've come to understand is that the same pandemic is being experienced very differently by different sectors of our community. So we're seeing differences in mortality, so people from BAME backgrounds, people with a disability, those in our most deprived communities have experienced higher mortality rates. And it's not just the direct effects of coronavirus that are being experienced differently, it's also all of the indirect effects which are sort of channeled and influenced by these wider social determinants of health. So we know that loss of employment, for instance, has been higher in younger people. We know that some children will have found it really difficult to study from home, and we know how important education is on the long-term well-being and health of our population. And we know that health and social care staff are at increased risk of adverse mental health outcomes as a result of the pandemic. So it's not just the virus itself, it's the way that we've dealt with the pandemic, which has had a much broader impact on the economic and social fabric of our society. But having said that, there are also a lot of mitigation measures that have been put in place, and all of this information is highlighted in the videos, and this is a report which is being presented in video format. So the report also makes some recommendations about what we can do to address the inequalities which have become even more apparent and which are attributable to events over the last 20 months. So I just sort of thought I'd quickly go through what the videos are about. So the first one is a bit of an introduction and an overview, and just explains what the gist of the report is and what we're hoping to achieve. The second one really focuses on income, job security, social isolation, and mental health. And I'm not going to read through all of those, but you know, there are a number of national reports which are backed up by local data, which describe in quite a bit of detail the impacts that all of those issues have had on the health of our population. The third video talks about how the wider determinants of health have shaped experiences, talks about that in the context of poor housing, and it has looked in a bit of detail at health behaviours. And we've got some evidence from Balance, which is our regional alcohol programme, which suggests that alcohol consumption has been polarised even further than it had been before. So heavy drinking has increased, but it has increased in those who were already heavy drinkers, and we know that those heavy drinkers are disproportionately spread or disproportionately exist in our more deprived communities. The fourth video really focuses on those groups who have been affected more than others, and particularly children and young people, and those populations who have been digitally excluded. So we know that individuals living in areas of high levels of deprivation, people who are from a BAME background, people with learning disabilities, older people with long-term conditions, and people with pre-existing mental health conditions have all been disproportionately impacted by the pandemic. But there are also some less obvious groups who have been impacted. So health and social care workers, unpaid carers, and a whole raft of other groups who have been affected by the pandemic more than others. And then the final video really sort of pulls together not all of the council's response, but some key elements of the council response, particularly looking at the support we've given around employment, the work of the libraries in terms of improving well-being. Libraries have been fantastic in terms of keeping in contact with people that they know are regular users of libraries service. They've been an absolute lifeline to a lot of those people. And we've also invested a lot in digital access to libraries to make sure that as many people as possible can still access that service. There's obviously the work that Northumberland Communities Together has done, which has been absolutely instrumental in particularly supporting people who have needed to self-isolate, our clinically extremely vulnerable communities. And it talks in there, we've also covered in there the ramping up of support for the homeless. So in terms of recommendations, one of the things that we've recommended is that we undertake an inequalities impact assessment, and actually the first cut of that was presented at the Health and Wellbeing Board this morning. And the purpose of that really is to look at what outcomes have been affected and how we can minimise or prevent those negative experiences from being exacerbated further. We also, I'd also recommend that we introduce an equality assessment and a carbon reduction assessment on policies and programmes. Actually, those are already in there, but the suggestion is that we need to include as part of that assessment process an inequalities assessment. So this is about developing an integrated approach to these three priorities, and that would certainly be consistent with the health in all policies approach that we're developing across the organisation. I think the third point is around community resilience. I think community resilience is really key, but we won't have resilient communities if parts of those communities are being left behind. So we really need to work together to focus on those experiencing inequalities so that the whole community is more resilient and better able to cope with future challenges. And then the fourth point is really about supporting our own economy, because we know that health and wealth is really closely related, and we can do that through shopping local, by supporting local businesses, local skills development, and by trying to get the most out of the Northumberland pound. So that's just a sort of brief overview of the report. Very happy to take any questions, should anybody have any.
Okay. Councillor Bowman. I'm sorry, thank you, Liz, for that. Councillor Bowman.
Yeah, thank you for the report. While I was reading through the report, it came to mind that I was actually living through this. I was actually witnessing it with my own eyes. The inequalities, the way that our society had been decimated by the COVID pandemic, and how the communities in which we all live in had, let's say, shrunk in its capacity to deal with it. We might have stories of great community get-together in the sense of supporting one another, but I see that what the pandemic has done, it has ripped our communities to the core. Those who are, I would say, who are poor to start with, have been made even poorer. Getting £86 taken off you at this time of year when you're on benefits is an absolute shocker. There's a lot of people in my community who are classed as food poverty, and it's absolutely a shame to say that that is the state of the nation. We're now in 2021, and there are people who have to choose between putting the heating on or having a meal, or even not having any heating and not having any meals. I'm just absolutely shocked at what I come across in the community. My wife will tell you that I go home with tears To be honest, it's absolutely disgraceful the way that some people in our community have been left behind. No fault of themselves, but it's the fault of the system. And it's if you become unwell in health and you live in a property that's damp and badly insulated, and it costs a fortune to heat, and you only get a certain amount of sickness benefit. So there you go. You have to make decisions. And I know that this is very well thought out, and to be honest, it just brings me to tears that we have witnessed this over the last 18 months, but actually the problems were there before the pandemic, and the problems have been magnified because of the pandemic. And those who have lost their jobs because of the pandemic, and those who've gone back to their workplace and are not getting overtime in which they relied on, they are also suffering as well. We see it right across our community. From one end to the other, a lot of people have suffered. How we get back to communities where we are better in health and we're better in our well-being is going to be a lot of hard work. I keep raising the issues about local facilities where I live that's provided by Northumberland County Council. Yes, we have a library, but it's only open one day a week. We don't have any leisure centres or sports facilities as such. We don't have what the towns and cities have, like community hubs. We don't have facilities like that. All we got is the odd community centre. So the part of Northumberland I live in is disfranchised because of a lack of investment. A lack of investment, not just during the pandemic, but over decades. And it has shown now, when the pandemic has hit, as I said, the poorer became poorer. And it's really sad. But thank you for your report. I can see you really delved into it, and it's very concise, and it really hits the nail on the head. And if I can be any part of the development from this point onwards to enhance our communities, to bring them back to a place where they are stronger in their well-being and their health, and I want to be part of it. Thank you. Thank you, Chair.
Thank you, Councillor Romney. No, that's heartfelt. Councillor Hill?
Thank you. Well, I fully endorse the focus of the report and the recommendations and what Councillor Bowman has said. And I think one thing I always found about your predecessor, he always raged against social injustices, and I see that you it's good you continue to do that. Mine is just actually a slightly different point out of interest. Obviously, you've assessed the various characteristics in Northumberland and the problems in Northumberland and pockets of deprivation and an elderly population and so on. Was there any findings around how Northumberland in certain aspects fared better than elsewhere? So, for example, it would seem quite logical when you're talking about spread of infection that a sparsely populated area might fare better, being on the coast. Also, our communities tend to be, I mean, I know it's a slight jet, but we tend to know our neighbours more than elsewhere in the country. So was there any sort of findings or narrative around how we were better in certain ways than other places?
Well, we're certainly better at vaccinating people than most other places. And I think that is a testament to both our population and the joint working that we've done across the various agencies involved. I think there are lots of things that have worked really well in Northumberland, and actually that's you know, we've seen that much more recently as well. I think, you know, we have communities where we have, you know, great community spirit. They pull together in a crisis. And certainly we saw that at the beginning of the pandemic when people were having to self-isolate, when we had clinically extremely vulnerable people, you know, having to stay at home. The communities rallied round to support those individuals and to make sure that they, you know, they didn't feel left behind or self-isolated. Yeah, I think there are lots of things that we do really well. I think it's quite difficult to compare it to, you know, other areas in the country, because they would say that they do lots of things really well as well. Yeah, I mean, I think it's, I think Northumberland has probably come out of this relatively well. I think there are lots of other communities across England who have, where this has been, you know, particularly difficult for them, particularly those areas like Blackburn and Darwin, where they've had high case rates over extended periods of time. So I think, you know, we've done relatively well really as a county.
Thank you. Councillor Hunter.
Thank you, Chair. Just a couple of questions. First of all, thank you for the report, a good report, well done. It's the people with the mental health situations. I know that children has been suffering, and that sort of, we need to get issues sorted into place to help them before they can get the education to get back online again. But it's, what do we do with the ones that doesn't come out and shout for help, that is maybe still behind them closed doors? It's how we can try and access them, because if they don't come for help, how we can get to help them that's maybe got mental health problems, just come on through COVID and things like that. And again, it's accessing services locally, because, for instance, there was a blood testing service was held in one of the GP practices in Berwick, and that's now been stopped, and anybody that needs them blood tests have to go to either the RVI or Cramlington just for a simple blood test, as to, it's part of checking that organs and that are working. But, you know, you think, can that, you know, that's not helping the carbon footprint, plus it's not helping stay local. Thank you.
Thank you. Councillor Nisbet.
Chair. Mine's about, it's a great report, by the way, Liz, brilliant, but where we're saying about encouraging people to shop local and support those local businesses. Well, through the pandemic, it was really bad, but now it's got a bit worse through the Storm Arwen. That's why I'm a bit late today, because I've been seeing the businesses, local shops, and that's where my concern is now, because they're crying out. The Keelro's now shut in Blythe because of a condemned building. And it's looking for ways round to support them local businesses themselves. So they're supporting us, so we can support them. But is there any way at all through I know it might not go through your remit, but support them in any kind of compensation or anything at all like that? Because some of them, the 6 shops on the outside, have had to close, plus the whole of the inside's closed. You know, I know that the inside doesn't belong to us, it's Northumberland Estates, and the outside are just little independent businesses who are suffering now. Some of them are going to go out of business, you know. So it's just looking for some support for them, really.
Liz, are you able to help on that? And sorry, and Councillor Hunter, have you anything on her comments?
Yes. So shall I go back? I'll go back to your comments. So I think the issue around mental health in children and young people is really important, and actually it was really important before the pandemic. So we had invested quite a lot in mental health support in schools and in online or virtual platforms to support children, and also teaching staff as well. I think in terms of the pandemic, our health visitors and early years practitioners are really well placed to pick up early signs of behavioural or attachment problems in children. Of course, you know, we have those mandatory visits, which our health visitors have still been doing face to face throughout the whole of the pandemic. So I think we're sort of well placed to do that. But I do think we need to make sure that we've got the right support in place, because anecdotally what teachers have been telling me is that we're seeing when children came back to school last year, they saw some behaviours that they hadn't seen before. So, you know, we need to make sure that we give them the tools to be able to manage those. Oh, they've gone actually. I was going to turn to my NHS colleagues and ask them to pick up the issue about the clinics, but I'll pick that up with them separately. I think in terms of the Blythe issue, that's probably a bit separate from the pandemic. And I mean, I don't know what support we would be able to give individual businesses. I guess some of that is down to what their sort of insurance looks like and whether that is likely to pick up some of the costs that have been incurred.
Thank you. Councillor Dodd?
Yeah, sorry to say certain things. This is a scrutiny committee, and where we're supposed to look at reports and look for the positive things. And I heard earlier a rant of negativity, where we as a council, as a county, are trying to make things better for everybody that lives here. And all we hear is this festival of negativity from a certain councillor every time. We are investing in our schools, our leisure centres. We are encouraging jobs to come here, real jobs. And I welcome this report, but I would welcome some positivity to get things going. We have had a 2 years of a pandemic. We've got a storm that's knocked us all sideways. I want to be positive about the way we move forward and try and do things. So I reject an awful lot of what I heard. This is a scrutiny committee to make things better. Thank you.
Thank you, Councillor Dodd. I mean, it does say comments on the DPH annual report, and I think we have taken comments where possible. If there's no more, yeah, do you want to make a comment?
Thank you, David Thompson,
Yeah.
Health Watch, Northumberland. I've been blessed with the opportunity in the last 2 days, yesterday and today, to attend the county's Primary Care Commissioning Committee, its System Transformation Board, its Health and Wellbeing Board, and its OSC today. And it's interesting, during those 4 meetings right across the county, representing just about all the partners available, COVID has obviously been very important, but so has this issue of health inequalities. And within the integrated care system, it is one of the 4 main priorities of that system's work for the future. And having listened to many, many people, far better than me in terms of knowledge, skills, expertise about this critical area for Northumberland and the country, there are many, many people working very, very hard to come up with plans to take this county forward. There is the Trust's Community Promise, the Healthcare Trust. There's the System Transformations Board, Population Health Management. There's the county's Community Impact Assessment and the Public Health Report. And they're all moving in exactly the same direction, which is great. But looking at it from the outside, it seems to me that the pieces of the jigsaw are there by these hard-working professional people who know what they are doing and they know what they can do. But what worries me a little bit is that the jigsaw pieces are on the table, but they are not yet joined up. And I think somebody, somewhere, some organisation needs to bring all of these partners together who are doing fantastic work into one corporate whole. And I say that because that's in the interest of the population, but it's also in the interest of the staff. They're so busy, we can't have many groups working towards the same end. They're being overlapped, duplication. So it's a plea from a public perspective. Can somehow this county bring all these good people with good, positive ideas together so there's one corporate, consistent, coherent plan? And I would suspect, even suggest, that the body to do that, to bring all the partners together, and I mean all of them, including the social determinants, would be the Health and Wellbeing Board and its joint needs assessment and planning. That may be sort of ridiculous thinking, but I think somebody somewhere needs to bring all of this excellent work for the future into some sort of corporate plan without diluting any initiative and so on, but so there's consistency and it's efficient and it's effective. The people are there to do it, but we need some sort of corporate thinking to bring it all together.
Thank you. I'm going to pass you over to Liz, who I think has been able to discuss that. And then, unless there's any other comments, we'll move on to the recommendation.
Thank you. I mean, I think you make a really good point, and I think that's what we were trying to get out of the Health and Wellbeing Board meeting this morning. There's a lot of work going on around inequalities. The ICS has got a Health Inequalities working group. The Northumbria Trust has got a Healthcare Inequalities Board, and as a council, we're really keen to develop an inequalities plan. And actually what we need to do is to bring all of those work streams together and develop an inequalities plan for the Northumberland system. We need to make sure that we are working coherently and consistently, taking into account the ICS priorities and our local priorities, and just make sure that we're focusing on similar things and working together, because actually the sum of the parts is going to be quite significant. What we agreed at the board this morning was that we would develop an inequalities summit for Northumberland, and that we would use that to have a good discussion about how we develop the plan and what our priorities should be, because I think at the moment there is a real appetite to do that bit of work, and it's the right time to do it as we hopefully transition from response into a recovery mode.
And could I just add, a lot of councillors here from all political persuasions, I'm sure as a county, which is well known for people working together, and the councillors present will see the importance of this in terms of the inequalities agenda, and somehow, as Liz has suggested, bring people together so we can move on quickly, because we need to move quickly. Thank you.
Thank you. So I am going to move on to the recommendations now. So obviously it was to accept comments which we've done, to accept and support the recommendations. And the recommendations you've got in your papers, but they are, I have to take my glasses off. The recommendations are to undertake a COVID-19 inequalities impact assessment and use that to inform the council's recovery plan to ensure that areas of deepening inequalities are recognised and addressed. This should inform future budget and planning cycles. To develop an integrated carbon reduction, equality and health inequality approach as part of our policy development and appraisal process. This would be consistent with the Health in All Policies approach that we are developing. To build on the strong community networks and increase social cohesion, to ensure residents are at the centre of processes to design initiatives and services which meet their needs and aspirations, and to encourage people to shop local, support local businesses, support the local development of skills to enable employment, especially those living in Northumberland who are furthest away from the employment market, and exploit the wider social value of the Northumberland pound. Are we happy to accept those recommendations?
Move acceptance.
Thank you. We'll just try back to the agenda. So we'll just move on the agenda, which is the report of the scrutiny officer. Could Ash, Krista, carry on?
Thanks, Chair. So the work programme belongs to the committee, so if there's anything that the committee wants to put on the work programme, all the committee has to do is ask either myself or Councillor Jones is the chair, and we'll try and put it on. As Councillor Hill said at the start about GP access, that's on the work programme for February for GP and dental access. That's on for February. And the end of life strategy that I know Councillor Bowman's asked for is also on for February.
Chair, we asked, Councillor Hill and I asked 2 or 3 months ago before you were on this committee about the paramedics at Berwick,
Yeah.
because that's to come to an end about March, and we're a bit concerned that it gets removed because it's a valuable asset in the Berwick Infirmary and it saves a lot of travelling for residents and that.
Can we put it on the work programme?
Yeah, it's possibly coming in January. I'm just waiting for NIAS just to come back and confirm that that date's all right with them.
Can we follow that up to make
Yeah.
sure? Yeah. Councillor Hill.
Thank you. Yeah, no, please, sorry, I missed that about the dentistry. It's something that I just think is going to be increasingly in the paper. I'm hearing stories that are almost like, I don't know, Victorian or before people pulling out their own teeth and stuff like that. I mean, it's just quite a very serious situation. Just the other thing, is there anything planned? I see in our terms of reference, one of the things is promoting cessation of smoking. Is there any, I mean, obviously this has been going on for decades. Is there any new reports or anything coming up regarding the effects of e-cigarettes and vaping? That does seem something that is, topical is the wrong word, but I think that's the most pressing thing in terms of smoking at the moment. I wonder if there's anything
Probably something that Liz could answer, but we can look to put something on the future work programme.
So, I mean, we can certainly bring the APBG report on tobacco and include in that report some of the evidence around e-cigarettes and what our own tobacco control programme is looking like. Would that be useful?
Yeah, because I mean, it is just, you almost think history is repeating itself. You almost feel it's the same thing happening with cigarettes, because I know people who gave up smoking and they're now smoking vapes and said, this probably isn't very good for me. I'm sure I'm going to, see things in the future. My guess is that they're probably extremely unhealthy, and it'll be like what happened to cigarettes. I think probably safer in terms of passive smoking, or there's no danger for other people. But I just think it's very relevant, and if there's some evidence or reports we could look at, I think they'd be worthwhile.
I mean, I think the evidence around e-cigarettes is that they are significantly safer than smoking. So the health harms of smoking outweigh any health harms from e-cigarettes. But we can certainly include that as part of the report.
Doctors used to prescribe cigarettes, but
Yeah.
We'll see that goes on the work programme. Councillor Dodd.
Yeah, I think we're going to get an inquiry or some sort of report of this storm we've just had. And I brought it up at a scrutiny meeting last week, that we probably, all of us, and I'll try and get the words if anybody in the press is reading this, my comments were about all of us as a county, as companies and individuals, households. We got taken aback by the force of this storm and the amount of time that electric was off. And I would like to think, because Chair, you and I know that there are pockets that have been off for 12 days. And in those pockets, there will be some vulnerable people. And I've had conversations with the Capheaton Parish Council, and probably more to come, about, we do this report on the roads every year, winter readiness. Have we got enough salt, or the grip bins full? We go over about the roads. But I'm not saying there's going to be another storm, but there will be. I think we probably need to start and look at, are we ready for any kind of an emergency, and what are the tools we need? I mean, little generators that don't cost a fortune in some little village halls to go straight out to people that rely on that electricity. I mean, and it wasn't just remote areas. I was out last Saturday and there was, I don't know if you're familiar with the Newcastle Airport, not far away from the hub. There's that bed and breakfast on the corner of the roundabout there. I think you've all seen it. And we couldn't get the gates open because there were electric gates. So we had to get a generator to plug in to get the gates open, to get in, to get help to a lady who was there, who lived there, for some medical equipment that needed power. So it's not just the far end of everywhere where certain people pop up every 4 years and save a community. It's about all of these areas and what are the weapons that we need. You know, I admit, you know, I used to check paraffin and candles and all that. Now I'm getting a bigger generator. You know, because the one I had was we would just do a light and the television. And I think I want to be a bit more secure. So I think we probably will have to, if we get over this winter and we get into calm waters, we could have a look at what do we need to do in case this happens again, because the signs are it's going to happen again. Thank you.
I'm just going to pass you over to Chris for the work programme. I admit that I was not ready for this winter. Chris will do that, and I'm aware that Councillor Ferguson has... do you want to do that now, Councillor Ferguson?
I just want to kind of add on to something that Councillor Dodd had said, and I welcome what he is saying, and I think what the point that you made about it not just being the rural areas, I think covering somewhere that isn't, well, it's probably semi-rural, but it's very much surrounded by the larger towns. I think this is a county-wide problem. There was about 50 properties in New Hartley whose power went off on Sunday just gone, so this was a week after the storm, but because of work that was being undertaken by the power grid, they had their power off for between 48 and 72 hours, and that includes some very vulnerable people. And I think we also suffered because we were on the coast, so we had some significant damage, not just to businesses, but to residential properties. And I mean, some serious damage where buildings have been condemned, as Councillor Nisbet's commented on in Blythe. And I think what Councillor Dodd is saying about having a winter readiness or an emergency preparedness kind of plan, I think is welcome. I don't think, though, it's something that Health and Wellbeing can do by itself. I think this is something that needs to incorporate every single part of this council, and I think it's maybe something we need to take or somewhere else to make sure that everyone gets done, and that so that we've got a plan that in these situations, in an emergency, there is a plan to protect the health and well-being of people, but also to protect the corporate things and all of that. And I think it's just making sure that we don't, maybe it doesn't need to necessarily go onto the work programme for here, but it needs to maybe something we can raise elsewhere further to make sure it incorporates everyone, if that's something that we can do.
Thank you.
Yeah, just to say, I know there's conversations going on about what sort of reports can go to what committees to look back at what's happened and about winter preparedness plans. So I'm sure something will be coming soon. It's just what that will look like in what committee. But the comments will be noted, and they'll go, and we'll send a report to the relevant committee, and members will be able to have an opportunity to feed in.
Thank you.
Can I just add to it, it's not just about electricity and power, and obviously the wind. It's also about floods, it's about rain, it's about our capacity to cope with heavy downpours. Basically, we should set up a committee that's and an organisation that looks into climate change as as it goes on around us, how we can mitigate against all these climate change activities that we get pounded with in the northeast. But yeah, it is about the new world that we live in and how we have to adapt and to change our well, it's our assets, isn't it? And there's technology, there's information, there's a lot of community support, I'm sure. But it all needs to be coordinated, doesn't it? And at the end of the day, I'm really thankful that there was nobody hurt in my ward. But I don't know about anywhere else. The lack of information isn't is not my main concern. My main concern was people getting hurt, or worse still, people dying. So in a way, it should come to the Health and Wellbeing Committee in that respect. It will have an impact in years to come on the life and the well-being of our residents. So I think it's good from time to time. We should have a report in the Health and Wellbeing Committee, Chair.
I think we have made a note of that, and we do have a climate change action committee, and I'm sure they'll be certainly looking at what's happened over the last few weeks as well. Thank you. The 4th of January, which seems like it's tomorrow. So can I just thank you all for today? Thank Liz and Jill for their presentations, and thank you all for coming. Thank you. Bye-bye. Safe journey home.